So you've stumbled upon the unfortunate reality of hitting your head, and now a fairly logical question starts rolling through your mind, that being, should I get imaging done on my brain in order to see if I have sustained a brain injury, or is it really even necessary? In 2018, the American Journal of Psychiatry published an article entitled Prolonged Postconcussive Symptoms. And within that article, they state that the vast majority of mild traumatic brain injuries, results of structural neuroimaging on CT and MRI immediately following the injury will be normal. However, when they do find things such as a hemorrhage, hematoma, contusion, or diffuse axonal injury, that's more consistent with a moderate TBI. This is an important point because they're stating that during a mild traumatic brain injury, imaging studies will typically come out normal. Versus a moderate and, of course, severe traumatic brain injury, you will likely find something. During the fourth consensus statement on concussion in sport, which was back in 2012, they stated that conventional CT and MRI scans almost always appear normal after concussion, even after repeated concussions. So, why would that be? Well, because whenever you undergo conventional imaging, like a CT or an MRI, as stated before, those imaging modalities are strictly screening for hard lesions, aka, is there something growing? Is there something bleeding? Is there a possible skull fracture? And when we're dealing in the range of a mild traumatic brain injury or concussion, you'll not find any of these things very likely. Also, I think it's important to emphasize how upsetting this can be for you because the only reason that one would undergo imaging, especially on your brain, is in search of answers. And so I hear it all the time from my patients how many of them are often relieved to hear that there actually is something wrong with their brain. Because when you don't feel normal, but all your doctors are telling you that you are, you can start sliding down this real slippery path of, well, is this all psychological? Is it in my head? Should I just try and power through all these symptoms that I'm now having? If that's you, I feel for you because you don't feel normal, or at least you aren't operating on all cylinders. And so when someone can actually objectify your complaints and discuss how they may be able to help you climb that mountain, it has to be incredibly liberating. But back to imaging, I recently put out a video on the updated definition of concussion. So every few years, there's a consensus statement put out in regards to concussion, and in the latest consensus that was held last year in 2022, the definition of concussion, first off, it's kind of a long definition, so if you want to hear me break down the whole thing, I want you to click right here. But within that definition, they state no abnormality is seen on standard structural neuroimaging studies, as in a CT or MRI, but in the research setting, abnormalities may be present on functional blood flow or metabolic imaging studies. So, what they're saying is that unless you have access to these real fancy imaging modalities, which are only available within the research setting as of today, you probably won't find anything. But maybe you're watching this video years from now and those imaging modalities that were once only available in the research setting are now common practice. Who knows what will happen in the future? So, is imaging after knocking your head on something necessary? Well, if a patient makes their way into my office and they've already had it done, then I kind of think of it as a bonus because it gives me the comfort of knowing that we've already checked off some of those more severe things like a hematoma or a hemorrhage or a skull fracture, etc. But if you haven't had one of those, I'm typically not real concerned with ordering one unless there are findings during the exam that make me think that things may be a little bit more serious here. In fact, per the American Association of Neurology and the American Medical Society of Sports Medicine guidelines, they state that in concussion, imaging should only be performed if there are concerns regarding skull fracture, intracranial hemorrhage, or other intracranial pathology based on one's clinical examination.